In a statement that rapidly rippled across social media and news platforms, President Donald Trump recently advised pregnant women against using Tylenol. He linked the common over-the-counter medication to an increased risk of autism in children, a claim that taps into deep-seated parental anxieties and the ongoing public search for answers about developmental disorders. This assertion, made without the backing of established scientific consensus, has thrust a decades-old medical debate into the harsh glare of the political spotlight, creating a potent mix of fear, confusion, urgent public health messaging. The incident serves as a powerful case study in how complex scientific discussions can be distorted when they enter the highly charged arena of modern political discourse. The central claim, that Tylenol or its active ingredient acetaminophen causes autism, is not new, but its amplification by a figure of Trump's global prominence gives it unprecedented reach. It prompts an immediate and critical need to separate speculative association from causal proof, a distinction that is often lost in the rapid-fire exchange of online information. For millions of expectant parents who have long regarded acetaminophen as one of the few safe options for managing pain and fever, the comment has sparked considerable alarm. Health professionals and scientific bodies have been compelled to respond swiftly, working to contextualize the research and prevent a wave of panic that could have its own negative health consequences for both mother and child. This controversy highlights a growing and troubling trend where complex medical science becomes fodder for political narratives. The discourse surrounding autism's origins is already fraught with a history of misinformation, making it particularly vulnerable to simplistic and alarming claims. When a political leader ventures into such territory, the message often transcends the scientific evidence it purports to represent, becoming instead a symbol of broader ideological divides. The public is then left to navigate a confusing landscape where the measured, cautious language of science competes with the loud, confident certainty of political rhetoric, making informed decision-making exceptionally difficult for those most affected. The sudden surge in public concern necessitates a careful examination of the facts as they currently stand. What exactly is the scientific evidence linking acetaminophen to autism? What do leading health organizations like the U.S. Food and Drug Administration and the UK's National Health Service actually advise? And what are the real-world risks when pregnant individuals, acting on alarming headlines, abruptly stop using necessary medications? Tylenol is the widely recognized brand name for the drug acetaminophen, known internationally as paracetamol. It is one of the most commonly used medications in the world available without a prescription to treat mild to moderate pain and reduce fever. Headaches, muscle aches, colds, flu. Its ubiquity on pharmacy shelves and in medicine cabinets makes it a go-to remedy. For pregnant women, its role has been particularly significant. For many years, it has been one of the very few pain and fever relievers recommended by doctors during pregnancy, ibuprofen, aspirin, especially in the later stages of gestation. The widespread recommendation of acetaminophen in pregnancy is rooted in a long history of observational data suggesting it was a safer alternative. Conditions like high fever, if left untreated during pregnancy, can pose serious risks to fetal development, including an increased risk of certain birth defects and developmental issues. Therefore, the ability to safely manage a fever has been considered a crucial aspect of prenatal care. Doctors have traditionally weighed the potential but unproven risks of the medication against the known, tangible dangers of the condition it treats. The scientific inquiry into a potential link prenatal acetaminophen exposure and neurodevelopmental outcomes like autism has been studied in numerous epidemiological papers over the past decade. The BBC article summarizes this body of work, noting some studies found a statistical association. An association is often misunderstood. It means two things are observed together more than by chance. It does not prove that one caused the other. These studies have methodological limitations. A primary challenge is measuring medication use accurately. Most rely on maternal recall months or years later. Human memory is fallible. Mothers of affected children may scrutinize pregnancy history more, recall bias. That can create or exaggerate a link. Another hurdle, confounding by indication. The illness that prompted treatment may be the cause. Pregnant women use acetaminophen for fever, inflammation, severe infections. Those conditions are potential risk factors themselves. It's hard to disentangle medication effects from illness effects. In response to circulating claims and public anxiety, major health organizations have been clear and consistent. The American College of Obstetricians and Gynecologists, the FDA, the European Medicines Agency. They reviewed the evidence and did not change their recommendations. They do not advise a blanket ban on acetaminophen in pregnancy. Guidance: use medication cautiously. Use the lowest effective dose. Use it for the shortest possible time. Use only when medically indicated. Experts warn abandoning necessary medication can cause more harm than good. A high, untreated fever in pregnancy is a known risk for negative outcomes. Neural tube defects, other developmental problems. The immediate danger from fever often outweighs hypothetical, unproven risks from the medication. Dr. Sarah Stock, paracetamol remains first choice in pregnancy. Alternatives like ibuprofen carry known risks. The health body's consensus is a call for calm and working with a healthcare provider. They acknowledge public concern and call for more research. In the face of conflicting information and alarming claims, the most crucial takeaway for expectant parents is to ground their decisions in dialogue with trusted healthcare professionals. Your doctor, obstetrician, midwife. They can provide advice that is tailored to your unique health history, the specifics of your pregnancy, and the most current, comprehensive body of scientific evidence. Avoid making abrupt changes to your health regimen based on a news headline or a social media post. Open, honest conversation with your care provider is the safest and most effective path forward. When discussing acetaminophen with your doctor, you can ask specific questions to ensure you are making a fully informed choice. Inquire about the reasons a medication might be necessary, such as the risks of an untreated fever. Ask about the lowest dose that would be effective and the shortest duration for which you should take it. This approach aligns perfectly with the official guidance from all major health bodies and ensures that you are using the medication in the most judicious way possible, ensuring that medical choices are guided by evidence, not by fear. Thanks for watching New News.